Hello dear friends, how are you doing today? I hope you are doing well. Welcome to a new question about dermatology. A 49-year-old man is reviewed in the dermatology clinic complaining of losing hair. Examination reveals generalized scalp hair loss that does not follow the typical male pattern distribution. Which one of the following medications is least likely to be responsible? A. Colchicine, B. Cyclophosphamide, C. Heparin, D. Carbimazole, and E. Phenytoin. Okay, here we have a 49-year-old man coming to the dermatology clinic with chief complaint of losing hair. On examination, we can see generalized scalp hair loss or alopecia, which does not follow the typical male pattern distribution. And this question is asking about the medications which is least likely to be responsible in generalized scalp hair loss or alopecia. Amongst these choices, phenytoin is a least known drug for alopecia and is known drug for hirsutism rather than alopecia. Here we are going to explain it. Explanation: phenytoin is an anticonvulsant drug, is a recognized cause of hirsutism, excessive hair growth in male pattern distribution rather than alopecia. Drug-related hair loss usually happens in two main patterns: anagen effluvium, sudden loss of actively growing hairs in anagen phase, happens days to weeks after exposure to the drug and caused by drugs that damage rapidly dividing cells, example chemotherapy. And telogen effluvium, premature shift of hairs from the growth or anagen phase to the resting or telogen phase. Hair loss becomes visible 2 to 4 months after starting their drug and usually reversible after stopping their medication. Common drug classes causing hair loss include chemotherapy agents which cause on anagen effluvium, like alkylating agents like cyclophosphamide, ifosfamide, and anti-metabolites like methotrexate, 5-fluorouracil, and cytarabine, and some other chemotherapy drugs also. Anticonvulsants usually affect on telogen effluvium like heparin and warfarin. And antihypertensive drugs include beta blockers like propranolol, atenolol, and metoprolol, and ACE inhibitors, but it's very rare and not well established in ACE inhibitors. Retinoids like isotretinoin and acitretin. In acitretin, one of the most frequent reasons patients may discontinue or change treatment is alopecia. And anti-thyroid drugs like carbimazole or propylthiouracil or PTU. Anticonvulsants drug like valproic acid and phenytoin. And about phenytoin, as we said, between alopecia and hirsutism is significantly more common with phenytoin use. And psychiatric drugs like lithium or SSRIs and tricyclic antidepressants, but this one is less common. Other drugs which lead to alopecia include allopurinol, colchicine, interferons, and amphetamines. Side effects can be alopecia. Okay, this was a short explanation about the drugs responsible for alopecia. Thank you for your attention.